Trigeminal neuralgia is a facial pain syndrome that is almost always on one side. That is an episodic pain that people feel in their face. It has a tendency to wax and wane. It's more common in women than men, and it's more common as we age. The symptoms for this are very typical in a sense that people describe an electric shock-like pain that will radiate onto their face or inside their mouth. It typically is triggered by brushing your teeth or washing your hair. It can certainly come and then go away for some time, but once the diagnosis is established, the initial treatment is almost always medical, where we use medicines over time to treat the facial pain. But over about 5 to 7 years, most people fail medical management and need to go on to surgery. There are studies that show that upwards of 70 out of 100,000 people will develop trigeminal neuralgia as we enter into our 70s. So it's not that unusual that patients will develop a facial pain or a pain inside their mouth and be seen by a dentist, and their diagnosis is truly trigeminal neuralgia and not something either dental in origin or from their sinuses. And the study compared what we consider to be the gold standard of surgeries for trigeminal neuralgia, which is a posterior fossa exploration, where the hope is to find a blood vessel pushing onto the nerve which can be displaced or moved, compared to stereotactic radiosurgery, where radiation is directed onto the nerve in the hope of creating a mild degree of nerve damage, which will also relieve patients of their facial pain. In this study, the groups were quite comparable, and what we found over a follow-up of approximately 3 years is that patients having a posterior fossa exploration were more than 2 times more likely to have pain relief without the need of any medications in the future. The surgery itself was found to be very safe, and the degree or incidence of facial numbness of these patients having microvascular decompression or posterior fossa surgery was much lower than patients having stereotactic radiosurgery. When we see patients at our center, we typically recommend a posterior fossa surgery as the first line of management if you've failed medical therapy. There are certainly considerations in terms of patient's age or other medical comorbidities where we may offer other surgical approaches, but our most common approach for this disorder is to proceed to a posterior fossa exploration.